Tonight, as the number of coronavirus cases here in the U.S. tops more than 600,000, we talk to a doctor on the front lines of the nation's battle against this potentially deadly disease. Dr. Eustace Fernandes is a pulmonary and critical care specialist in Indiana, and he joins me now by Skype. Dr. Fernandes, thank you so much for coming on.
My pleasure.
Well, no, first off, we should probably let our viewers know that you're speaking to us as an individual and not on behalf of the hospitals where you work. So we want to make sure that everybody knows that. I know that you've been treating patients with COVID-19, many of them so ill that they ended up in the ICU. Can you talk about those patients' needs and also how caring for them differs from what you're used to seeing?
Sure. Anytime someone ends up in the intensive care unit, it's a moment of stress. It's a moment of anxiety. Obviously, they're coming to us because they are critically ill. They're at some point in their illness, and sometimes it's the early phases of illness where we choose to move them to the intensive care unit for fear that they might worsen and to initiate early and aggressive therapies to try and prevent them from needing a ventilator. More often, what we're seeing in our intensive care unit is that patients are coming to us already critically ill and requiring a ventilator. So at that point, they are greeted by a team of people who have spent their entire careers preparing to take care of them. So this includes doctors, respiratory therapists, nurse practitioners, physician's assistants, pharmacists, and respiratory therapists. And these people are highly trained, highly skilled, and they have two things in balance. First and foremost is taking care of the patient. The second is taking care of themselves because they don't want to become a healthcare worker who has become infected. So the care is highly specialized, and most of it consists of good supportive care. So what I mean by good supportive care is that the work of breathing is taken care of either by supplemental oxygen or a ventilator machine. Nutrition is cared for, their skin is cared for. We're watching very carefully for signs of secondary infections that can occur after the coronavirus has done its damage. And of course, we're looking for this intense inflammatory response. It's the body's immune system that seems to be hyper-responsive to COVID-19 and can do a lot of damage to the body, particularly the lungs.
Can you talk a little bit more about that, the damage that it can do to the lungs? Is it something that you've seen with, say, other conditions, or is it much more intense?
There are similarities between a severe case of seasonal influenza, or it's probably more similar to the H1N1 epidemic from a few years back. What I've noticed in our care of the patients with COVID-19 is that they seem to come to us sicker. Their ability to retain their oxygen levels is much poorer, and they seem much more medically fragile. There is a certain feeling of helplessness when they enter this spiral where you can't get enough oxygen to the body, and then other things begin to collapse, such as their blood pressure or their kidney function. And so it's similar in some ways, but the level of severity of illness seems a bit higher.
You know, I want to ask you this last question. I know we don't have a lot of time left, but I'm sure this has been an incredibly tough time for you in your profession. As a Catholic physician, can you talk about your faith a little bit and how it's helping you during this time?
My faith animates everything I do, and my father, who recently passed away, taught us that we need to see Jesus Christ in our patients, and that's what I try and do. It's an incredibly isolating experience to be sick with COVID-19, and just trying to be present to the patient as much as possible and try and care for their every need. Another important part of this is caring for the family. We don't allow visitors currently. So we make a point of calling the family every day. The physician calls the family every day and said, this is what's happening with your loved one. This is what I'm worried about today. So it's a way of ministering to that family and consoling them when they're just filled with anxiety and can't be at the bedside of the people they love the most. I pray constantly that the Lord will guide my hands, guide my decision-making, because we are really in uncharted territories. And then the last thing, I try and keep in mind that all of this is part of the plan of a loving Father. And so there are many things that are tragic and many things that we don't understand. I do understand that in the end, Jesus Christ is triumphant over everything. And I rely on that to get me through difficult moments and great human tragedies.
Well, Dr. Fernandes, thank you for sharing that with us. Thank you for coming on. And most importantly, thank you for all that you're doing. We really appreciate it. Dr. Eustace Fernandes, thanks again.
Thank you very much.